Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Next, we move on to the Eales syndrome. So, this Eales syndrome is also known as the keratostylohyoid syndrome. So, it is known as the AKA the keratostylohyoid syndrome. And it is nothing but it has a characterized elongated styloid process. It's elongated styloid process, and it produces, or it has an elongated styloid process, or a calcified the ligament, or the calcified stylohyoid ligament. Next, how is the cause? So, what is the etiology? Etiology is by, it is seen in case of post tonsillectomy or the post pharyngeal trauma. Post tonsillectomy, or it is also seen in case of the post pharyngeal trauma. Next, it is most common in case of the females. It is more common in case of the females, and it is in the ratio 3:1. Then moving on to the clinical presentation. The clinical presentation is that it is bilateral, and the presentation, there are two kind of presentation. So one will be known as a classic Eagle syndrome, and the second one is going to be the stylocarotid syndrome. So stylocarotid syndrome. So first let's look at what is the classic Eagle syndrome. So here in the classic Eagle syndrome, there is dull persistent pharyngeal pain. So dull persistent pharyngeal pain, and it is referred to the ear. So it goes to the ear. Next, the pain is exacerbated by the rotation of the head. So there's increase in pain with the rotation of the head. There is also a palpable mass. There is a palpable mass or bulge in the tonsillar area. There is a palpable mass, or you can call it a bulge, and this is seen in the tonsillar fossa. And other associated symptoms, such as you can have dysphagia, you can have the FPS, foreign body sensation, as well as tinnitus, and the cervicofacial pain may be seen. So cervicofacial pain, this may be seen. The next presentation is the stylocarotid syndrome. Stylocarotid syndrome. So in this stylocarotid syndrome, it is nothing but the compression of the internal or the external carotid artery. So there is compression of the internal carotid artery or the external carotid artery, and this is by the medially or laterally rotated styloid process. This is by the medially or the laterally rotated styloid process. So how do you treat this Eales syndrome? So treatment wise, it is by the styloidectomy. Styloidectomy in those not responding to the conservative treatment, you give analgesic. So analgesics can also be administered. So styloidectomy in those who are not responding to the conservative treatment with the analgesics. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.